Digital health is growing at pace and not slowing down one bit. Healthcare, the way we do our jobs, the way patients interact with all of us, it's all being transformed by the advancements in health tech. And I think for the better only. Now, if you're watching this video, you're still an early mover. Digital health hasn't engulfed everyone yet. You're most likely here, however, to learn about what jobs exactly exist in the digital health space. Now, in this particular part, it's going to have to be a series given how many jobs are out there. I'm going to start at a very broad and popular job level. Now, before we dive into the various different jobs in digital health, I'd love it if you hit that subscribe button below. Okay, let's dive straight in now. Healthcare professionals with tech skills. Now, it's a no-brainer that if you have tech skills, you are incredibly valuable to the build side of things. This involves coding, so literally the building blocks of the digital health solutions, or it might be design, specifically UX and UI. The difference between the two is essentially how a user feels when using a product versus how the product looks and functions. The question that you're probably now thinking of is, well, if you're going to go and apply for these jobs, aren't you suddenly in a massive pool of techies who've basically done computer science at Stanford, Oxbridge, and other leading institutions? Well, here is where being a healthcare professional matters. You have experience and deep insight into how healthcare operates at a ground level. I'll give you an example. Say you're the coder or the UX and UI designer for a virtual pharmacy app that allows patients to get their drugs delivered at ease. Now, repeat prescriptions like codeine may be given by the GP. Now, the non-healthcare tech person will probably just create a button, label it, request codeine drug delivery, and they can click it, they get their delivery, but it doesn't restrict the patient, and so they can click it again and again and again. Now, with your healthcare hat on, you will realize that codeine can be dangerous. So you may suggest that actually, once the button is clicked once, the button actually freezes and unfreezes in about a week or two. And in the interim, the patient can actually be recommended to just get in touch with the doctor if they need more codeine. Now, this is what it means to be a healthcare techie. You understand patient care, you understand safety, and you understand the nuances that a coder that isn't a healthcare professional won't know about. This is what makes you an attractive hire. So say you can't code and you can't design. Well, there's another category I want to talk about, and that's about healthcare professionals who are good with data. To be honest, a lot of healthcare professionals are good with data because a lot of us get involved in research and have to handle statistics and present it all, usually at a conference of some sort. So a lot of us are good with data. It's not an easy feat, and therefore it gives us an unfair advantage as healthcare professionals. To be honest, medical school didn't even teach me how to handle data. I learned it more during my intercalated year, and that's why when medical students ask me should they do an intercalated degree given that it's not worth any FPAS points, I say, well, is that intercalated degree going to teach you skills that you particularly want? And if you want those skills, it's definitely worth it. So let's talk about a job that you could be offered if you were good with data, and that's being a healthcare data analyst. And essentially you do what it says on the tin. You would be part of a team collecting data, cleaning and preparing it, analyzing it. You may assess efficacy, or you may be doing predictive modeling. Essentially, you'd be taking data and feeding it back to fuel the mission of the digital health solution. So the two types of jobs I've gone over so far, being a developer, a coder, or UX UI designer, or working with data, now they involve an element of deep analytical and technical skills, to be honest. But what if you have no tech skills and you're not very good with data? Don't worry, there's room for you too. Let's talk about product management. So product managers would be responsible for the development of a digital health product right the way, pretty much from conception, I'd say, working with the founders at that stage, to delivering it into the market. Now, a product manager isn't the lead of the whole startup or business, otherwise you'd be the CEO or founder. Rather, it is a more specific granular role over a specific product. Let's take, for example, you may be the product manager for Google's AI MedPalm. Your tasks would involve defining the vision of MedPalm. What is it? What need is out there for it to meet? You would need to do market research, define the requirements. You would work with the engineers, the designers, the data analysts, the regulatory experts, and all the other professionals that exist to bring that product, MedPalm, to life and into the market. Think of it as being the football manager rather than the players, ensuring that you've got the team set up correctly, the strategy, you understand the opponent, and you've got all the players ready to go out there and do the thing that they're all best at. That's what product management is about. The next job I want to talk about, and it's quite closely tied with a product manager, is the clinical informatics specialist. This is a job for healthcare professionals who specialize in bridging the gap between technology systems and healthcare delivery. So whilst a product manager is making sure the product makes it to the market and meets the company's objectives, the informatics specialist is making sure the product fits the healthcare systems, pathways, and enhances patient outcomes. The clinical informatics specialist is part of the wider team working closely with the product manager. So let's put the product manager and the clinical informatics specialist into an example so you can understand what is it like in the real world. So say you are the CEO of a new clinical decision support tool that detects sepsis better than anything that's out there at the moment. And you've got Abdul as the product manager. Now he would be in charge of setting the vision for the product, not for the whole startup and organization, doing the market research, setting the requirements, and working with the tech team to get it built and launched. Now say you then hired me as the clinical informatics specialist. I'd be responsible for collecting and analyzing the data involved, developing an algorithm, integrating the product Abdul delivers with the healthcare system so it actually does the job that it's supposed to do. At the end of the day, a healthcare professional needs that tool to flag up a septic patient to be urgently treated. I would therefore also be responsible for training the workforce to also use the product. You can see how the role of the clinical informatics specialist goes hand in hand with the product manager. Now I'd say the clinical informatics specialist is a little bit more involved in the data, the analysis of all the data, and is a little bit more techie, but is particularly focused on integrating that product into the healthcare system. Whereas the product manager is a bit more focused on the product itself and getting it delivered. The final job I want to talk about in this video is a very popular one. We're seeing it all over LinkedIn, Twitter, to be honest even TikTok and Instagram, and that's healthcare consulting. This is where you are very learned and you provide expert advice, guidance and solutions to healthcare organizations, startups and even established corporations to improve their strategies, operations, implementation, efficiency and patient care outcomes. You can see it's a massive definition. I had to Google it to bring it up for this. It's going to need its own separate video, but I hope you get the picture. In consulting, there's loads of different departments and verticals you can go into. Now this job essentially requires you to have in-depth knowledge of the healthcare systems, regulations, and to be honest, just industry expertise. With consulting, you might be working for a massive company like McKinsey, or you might be more independent. We've got loads from both sides on the spectrum on Peerr, so check them out at www.peerr.io. If you want to hear from people who are in the various different roles, check out our podcast, The Scrubbed In Show. I've linked it in the description below and you get to have a good insight from people who are actually doing it. I'm not doing all those different jobs. Okay, so in this video, to summarize now, I've covered some of the more popular jobs at a macroscopic level. You've got number one being a developer, i.e. the coder. Number two, a UX UI designer. You can be a data analyst, a product manager. You can be a clinical informatics specialist, or you can go into consulting. If you'd like to see videos dedicated to each job going in at a more granular level, then let me know in the comments below and I'd be happy to do that. Otherwise, I'll see you in the next video.